There have been quite a few different modules over the years, but I'd say my favourite is definitely professional clinical practice, which we do this year. We run an injury clinic for the public, so you get to really practice everything that you've learned. So there are quite a few different options. A lot of people go into professional football, rugby, various different sports. You can also work in gyms, and there's also quite a lot of opportunities to be self-employed as well. So a lot of people set up their own injury clinics or sports massage businesses, and a lot of people actually run them whilst they're a student, so you can get a good sort of client base ready for when you graduate. And it's also a really good course if you want to go into further study as well. I'm thinking of going into physiotherapy, so it's going to set me up really well for that, with all the kind of anatomy that we've learned and rehab. And there's also the skills are quite transferable to lots of other postgraduate courses as well. Anything from teaching to sports psychology, there's quite a few different options. For me, it's just how kind of close it is to different restaurants. There's all sorts of cinemas, shops, and it's also really close to the railway station and different, transport links. I commute from Wolverhampton, so it's really useful for me that the train station is, just a 5-minute walk away. I don't sort of have to get off the train and then get onto another bus. It's just really close, and yeah, it's really easy to get to. So I'm currently in 2 days a week for lectures, and then there's also a third day where there are workshops on, and they're run by the graduate teaching assistants. And again, that's just another way for us to really practice our skills. If there's something that you didn't understand in a lecture, you can go over it with the support of the graduate teaching assistant. So there are quite a few opportunities to go on trips on the sports therapy course. I've been to the Birmingham half marathon, where I provided post-event massage to the athletes. You can also go to the London Marathon and various different marathons across the country and ultra marathons. There's also a really good opportunity to go on the Ride Across Britain, so that's where you follow cyclists from Land's End to John O'Groats. And it's a 9-day bike ride, and you camp with them, you get up really early and do all the pre-event massage. Yeah, recently we went to King's College London, where there's a human dissection lab, and we got to dissect some bodies, it sounds really weird, that people had donated for medical science. Because one of the main things in our course is learning anatomy, so there's kind of no better way to learn it than actually seeing the real thing. So on the sports therapy course we have to do 40 hours of placement, and that's over the 2nd and 3rd year. I did mine in the local hospital to me in the physiotherapy department, because that's kind of what I want to go into after I graduate. And I spent some time with the outpatients department, the orthopaedic department, and on the stroke ward. And that was really interesting to see how they kind of differed to what we do. And obviously they work with a lot of elderly patients, which is something that we haven't done before. And I learnt a lot on that placement, because one thing that I struggled with in the injury clinics at first was time management, so trying to get the patient in and out as quickly as possible. He'd often run over on the appointments, so it's really interesting to see how the physiotherapists sort of manage to condense everything but still give a really good service to the patients, so I learnt a lot from that. To sum up my course in 3 words, I would say exciting, interesting and challenging.